Good day. In this lecture, we will be discussing about Slitlamp biomicroscopy. Now, it's hard to imagine having an ophthalmologic practice without having a slit lamp. And so why is a slit lamp essential? Well, the slit lamp is considered to be the gold standard for the assessment of the anterior segment of the eye. And this is so because a slit lamp has excellent image quality. It gives you stereoscopic image, flexible illumination, and a lot of magnification. What can we use a slit lamp for? On their own, slit lamp can be used for routine examination of most of the eye, and from the ocular adnexa to the anterior vitreous. It can offer a problem-based examination of the anterior segment. It's usually used for contact lens fitting for both soft and hard contact lenses, and it gives you a detailed assessment of the anterior chamber. With certain accessories, we use a slit lamp to do and perform gonioscopy, fructoscopy, ocular photography, applanation tonometry with a Goldman applanation. Okay, and of course, the slit lamp is the method for which we use certain lasers like laser photocoagulation. And we can also use it for ocular surface and dry eye evaluation. In its basic design, the slit lamp is divided into 4 parts. You have here the viewing arm, okay, wherein you have there the biomicroscope where you have your oculars. You have adjustable focuses for the eyepieces and a magnification dial. You have the illumination arm or the slit lamp where the light comes from, okay, the light source, where you can have varying degrees of changing the slit size, the shape, and filter controls. There's also variable size, shape, and color and brightness for the light. The biomicroscope and illumination are mechanically coupled around the central pivot point, which we can so call it as co-pivotal. Both focus at the same point, parfocal, which means that whenever you see the light focused, that's where your optics are also focused as well. That's why your slit lamp is usually called to be parfocal or confocal. Okay, both arms can swing independently at 180 degrees along the horizontal, and there's a scale. You'll see a scale between the 2 arms, so that if you have a particular view or a particular picture to take, you'll always remember at what particular angle you saw that particular image you wanted to see. Okay, and of course there's a chin rest and head strap for the patient, and a movable base plate and joystick control. So the 4 parts would be the viewing arm, the illumination arm, the chin rest and head strap for the patient, and the movable base plate where the joystick is located. Okay. Now, in its basic design, there are 2 kinds of slit lamps. You have the Hagstrite slit lamp, okay, the one on the left, and you have the Zeiss type on the right. Okay. Now, it's called this because they developed these designs, and so you will see that Hagstrite will only develop the Hagstrite type of slit lamp, and Zeiss as a company will only make the Zeiss type of slit lamp. But there are other manufacturers like Topcon or Reichert, okay, and they will actually make both types. So you will see a Topcon Zeiss type or a Topcon Hagstrite type, okay, of slit lamp, depending on what kind of design that you would like to use. A good slit lamp, though, has adequate working distance between the microscope and the eye to allow the practitioner to access the eye. It is adaptable to suit different practitioners, although in your own practice, if you have your own slit lamp, it should be adaptable just to suit you and not many other practitioners. Okay, it should have good resolution. And this is where the difference comes in. A very good, expensive slit lamp will offer you a much better resolution than an inexpensive one. Okay, it has good depth of focus and a wide range of magnifications. Okay, and of course, in these COVID times, you would need a breath shield to protect the examiner. Let's talk about magnification. Slit lamps provide variable magnification. Lower magnifications are used for general assessment and orientation. Higher magnifications are used for the detailed inspections of areas of interest. And there are several ways to do this. Common methods include a Littmann Galilean telescope or zoom telescopes. Okay, less common methods or old styles will require you to change the eyepieces and or change the objective lens, and these are obsolete. Zoom systems, okay, and you will find out when you eventually purchase your first slit lamp, tend to be found on high-end models. And the magnification can be very wide. They vary between 7x to 40x. Okay. In obsolete magnification, where you change the eyepieces, okay, often two sets are provided with a slit lamp. Okay, usually 10x, 12.5x, 15, or 20. But you will hardly find now slit lamps that will offer this option for you. Okay. Okay. The very common inexpensive type will have a flip arrangement for rapid change. Okay, so there's a lever which just gives you two magnifications. Okay, and typically between 1 or 2 times the magnification that they offer. Let's talk about illumination for your slit lamp. Okay, slit width. On the basic, your slit lamp will give you a round beam. Okay, and so that will change in widths from 0 to around 8 or 0 to around 14 millimeters, depending again on the type of slit lamp you manufacture. Okay, and so you can have that very, very thin or very, very wide. Okay, and it may be graduated to allow measurement. Narrow slits are used to slice through the cornea to determine depth or thickness. Wide slits are used to inspect surfaces. Slit height may be continuous or set to fixed heights. Usually a combination of the two, okay, may be graduated to allow for measurement or caliper function. So there's a caliper function, particularly in the Hagstrike type of slit lamps, that allow you to measure certain lesions, okay, like central microbial keratitis or epithelial defects or dendrites. Okay, long slits are used to view most of the structures in front of the pupil, while short slits pass through the pupil much better. So if you're going to take a look at the fundus, okay, you can only measure the amount of light that will go through the pupil so that you're not going to make it too bright for the patient to tolerate. Okay. Short slits are also used to assess the clarity of the anterior chamber, like in cells or flare. You can also change the orientation of your slit. Okay. And this is achieved by rotating the lamp housing. Okay. Slit lamps may have some or all of the following filters. Okay. You can have a diffuser, a polarizing filter, red filters, cobalt blue filters, or a rattan filter, which is used in contact lens fitting. But the rattan filter is in the viewing arm, and not in the illumination arm, as in all the other filters previously mentioned. What are the types of illumination? Well, of course, this is always important, and we'll always discuss this. You can have direct, okay, or indirect illumination. Retroillumination, which can be from the iris or the fundus, okay, sclerotic scatter, or specular view, which is used in viewing the endothelium. Okay, combination of these methods is also used to view various eye structures. Okay, let's talk about direct illumination. Okay, in direct illumination, the light and the microscope are both pointed at the object of interest, like here. And since your slit lamp is naturally confocal or parfocal in some terms, then you just point the light where it is, where the lesion is, and you will see it focused. Okay. There are several different forms of direct illumination, named simply by how wide the slit is. So you can have a diffuse illumination, wide beam, parallelepiped, or optical section. Okay. The slit width will change what you can see. Okay, so a diffuse wide beam for overall view, wide parallelepiped for broad views, and a narrow parallelepiped for a balanced view, or an optical section to cut through tissue for thickness and depth. What is the effect of the slit width, for example, on the cornea? So with a wide beam, you will see mostly surface, okay, you won't see too much depth, okay. With a parallelepiped where you have equal width and depth, there will be a balance, okay, of both the surface and thickness of the cornea. And in a very thin beam, you will basically just see an optical section, which is just mainly mostly depth or thick, in this case, thickness of the cornea. You cannot assess the surface of the cornea in this thickness or in this slit. Okay. Now let's talk about the angle. And why is the angle important? The angle between the microscope, the optical arm, and the illumination arm matters. Wider angles allow for visualization of the deeper layers without interference from the reflections from anterior layers. It's also used to estimate depth, and the wider the beam, the greater the angle needed to view the posterior surface layer, and allows for better perception of texture. For example, okay, and there's also a graduated scale located at the pivot point of the two slit lamps, which gives you the total separation between the two arms in degrees. So what is the effect of the angle on the cornea? For example, okay, if you put it at 45 degrees, again, there's a balance of surface and depth of the cornea. If you put it at 0 or 5 degrees, then all you see is the surface of the cornea. There's no way for you to see depth of the cornea or the anterior chamber at this angle. And if you put it at very wide angle, then you will see only the depth. There's no way for you to see the surface of the cornea in this regard. And so by playing around with your slit lamp, you will be able to determine more or less what you will be able to see and what will be hidden from you. So here's an example of a wide beam or diffuse beam, okay? It's used for the general inspection of the eye and adnexa. In this case, you can see nevi on the iris. It's also good for color assessment, such as in this picture, okay? It's used for contact lens fitting, okay? And a wide slit, diffusing inserted microscope in front of an illumination, okay? Patients are generally unable to tolerate the brightness of a wide beam. So if you're going to use a wide beam, you need to lower the magnification or put it at a particular angle so that it's not too bright for your patients. How about the parallelepiped? Here in the picture, you can see sort of a column of light, okay? And so it's the default method for corneal inspection. It shows a block of tissue in 3D. So there's a good balance between depth and the surface of the cornea, as you see here. Okay, so the beam, which is about 2 millimeters, okay, so there's a variable angle and medium to high magnification when you want to do parallelepiped. Okay, in optical section, this allows judgment of the thickness of depth. So for example, here, you can see more or less just by looking at this picture how thick the cornea is, okay? And it also tells you, based on the light on top of the iris, more or less how deep the anterior chamber is. So it gives you a good idea of depth, okay? Use the narrowest slit possible, okay? And of course, the largest angle possible to give you the best optical section possible, okay? High illumination in a dark room. How about indirect illumination? In indirect illumination, okay, the object being viewed is illuminated indirectly when lit by reflections or scatters of light that occur when the light is shown other than onto the object itself. So in this case, as you can see, you put the light a little bit off or adjacent to what you want to take a look at, in this case, the red dot, okay? And there are certain advantages to this. Indirect illumination is good for subtle detail, which would be obscured or washed out by large amounts of light or illumination. Okay, light internally reflected within the cornea or reflected by other surrounding tissues. Okay, opacities will scatter light, so they will appear light in color. It's best viewed against a dark pupil or a dark iris, which is not a problem for us Filipinos. Okay, so how you do this, you keep the slit width narrow to medium and view with a medium to wide angle. Magnification will vary depending on the size and extent of the object, but it's typically medium to high for subtle defects. Take a look at this picture, okay? So it shows a contact lens related condition called neovascularization. You can see that where the light is actually shining, the vessels look washed out. But when you look at the vessels adjacent to that light, then you can see that you can view them more clearly. And this is what indirect illumination can provide. Okay, so here you have directly illuminated. Okay, and then here you have indirectly illuminated. Okay, what about retroillumination? In retroillumination, an object of interest is lit by backlighting, okay, or retroillumination when the light source is directed onto another structure so that the reflected light must pass through that object. So in this case, light can be bounced back from the iris, okay, and sort of a backlight so that you can illuminate whatever object of regard you want to see, okay. So in this case, if you see those little dots on the cornea, that is actually lit by the light coming from the iris at the back, okay. Now, retroillumination, okay, the light may be reflected from two main structures. From the iris, okay, this backlights the cornea, or from the fundus, which backlights the lens and or the cornea, okay. Opacities will appear dark against bright background. For iris retroillumination, use a narrow, moderate width slit and a wide angle of illumination and magnification appropriate to the object size or extent. Okay. In some cases of retroillumination, decoupling may be necessary when the magnification is high. So decoupling means you will take away the confocality or parfocality of your slit lamp, and there are ways to do this. Okay. For fundus retroillumination, use a short slit and a narrow moderate width. And the narrow angle of illumination is almost direct, no? It's 0 to 10 degrees with moderate magnification. So again, let's go back to this picture. You have direct illumination, okay, which you can hardly see the vessels. There's indirectly illuminated vessels as pointed by the arrows. And this really bright one is retro-illuminated from the iris, as you can see. Now, here's an example of a retroillumination from the lens, from the fundus, okay, which allows you to see opacities in the lens, okay. And so this is a cortical spokes cataract, and you can see this by doing a fundus retroillumination, okay. You can also see keratic precipitates, okay, using the fundus. Okay, the thing with fundus retroillumination, obviously, you will have to dilate the eye. How about sclerotic scatter? In sclerotic scatter, the coupling, okay, really has to be done on your slit lamp, okay? An intense light is illuminated at the limbus at 4 to 5 degrees, but optical view is at center of the cornea, okay? You will need to have total internal reflection of the light through the cornea, and lesions in the corneal stroma will manifest to the observer. For example, here, you can see that the light is being shined on the right side of the picture. It bounces internally through the cornea, and you can see there's a halo of light that comes out the other side, on the left side of the cornea, okay? And you will see along the way that it's illuminating these very nice lesions on the cornea, okay? Specular reflection is a technique to view the endothelial surface, okay? It's done at a very high magnification, and the optical arm may have to be brought to an extreme angle to view. So here you might need to swing the optical arm all the way to around 80 degrees, okay, just so that you can view what you need to see, okay. Now, in a parallelepiped, as I mentioned earlier, a beam can be narrowed and shortened to examine cells and flare in the anterior chamber, like so, okay. So it's important, okay, once you use a slit lamp in your clinics, to keep it clean. You have to take good care of your slit lamp. Don't leave the switch on when it's not in use. I can't imagine how many times I've seen, no, or I can't recall how many times I've seen where residents and doctors will leave their slit lamp on, okay? They forget that it's on. So don't leave the switch on when it's not in use. You should learn to troubleshoot minor issues with your slit lamp, like the bulb or power supply, alignment and focusing problems, and always lock the base and arms when transporting your slit lamp, or even when it's not in use, so that it doesn't, the parts don't deteriorate when you're not using it, okay? And with that, thank you very much for your attention.